So it is true, is it then, that if you've got cardiovascular disease, you are likely to have higher levels of cholesterol?
No, it's not actually true at all.
So it's just it's a very strange hypothesis.
Well, no. Well, the hypothesis began because when people looked at arteries and that had atherosclerosis and thickenings and damaged areas, or whatever you want to call them, they found that they had a high percentage of cholesterol in them. All right, and then they said, well, where did this cholesterol come from? And the answer was, well, it must have come from the bloodstream, because where else can it have come from? Which is a reasonable hypothesis. Therefore, the raised cholesterol that you find is the cause of the atherosclerosis. No, that's yellow fingers and lung cancer all over again. This type of thinking is so prevalent in medicine. We find an abnormality and we decide the abnormality is the cause of the disease. We find beta amyloid plaques in the brain and decide that beta amyloid plaques are the cause of Alzheimer's. No, this is the body trying to repair itself, you idiots. We find cholesterol in arterial plaques. This is the body trying to repair itself. This is you getting it 180 degrees the wrong way around, as per usual. You idiots.